Struggling with understanding ABGs? You're not alone. Let's take a look at our patient, Mr. Jones. Here is Mr. Jones. Everyone say hi. Mr. Jones is going to help us understand different ways we can become alkalotic and acidotic. First, let's look at what makes you acidotic. We know there is either respiratory or metabolic acidosis. Either your kidneys are the problem or your lungs are. Let's look at the lungs first. Our bodies are meant to breathe at a rate of 12 to 20 breaths per minute. When we breathe slower than this, we can retain CO2, which causes our blood's pH to decrease. A decreased pH means your blood is acidic. A normal blood pH is 7.35 to 7.45. We are acidic when our pH drops below 7.35. Normal CO2 is 35 to 45. High CO2 means acidotic. This happens with asthma, COPD, sedatives or opioids, sleep apnea, pulmonary edema, hypoventilation, CNS depression, chest injury, pain, or trauma in the chest, or neuromuscular disorders. Patients will have decreased respiration rates, possible Kussmaul breathing, weakness, and chest pain. To treat this, we will give bronchodilators, stimulate the patient, give Narcan, and if needed, intubate the patient. Either way, you are solving the underlying problem. Now let's look at what makes you metabolic acidotic. We will need to look at the kidneys. When our kidneys excrete too much bicarb or HCO3, we become acidic. This is caused by DKA, lactic acidosis, organ failure, or diarrhea. Normal bicarb levels are 22 to 26. Low bicarb is acidic or acidotic, and high bicarb is alkalotic. A trick to remember: if you're losing fluids through your womp, you are acidotic. The patient can have neuro changes, difficulty breathing, and vertigo. A trick to remember treatment: you are low in bicarb, we are going to give you bicarb. Monitor the patient's respiratory status, correct the underlying cause, and monitor vital signs. Mr. Jones wants to talk about alkalosis now. Respiratory alkalosis happens from losing too much CO2. This occurs with hyperventilation, fevers, anxiety, fear, pneumonia, pain in the head or extremities, pulmonary embolism, salicylate or nicotine overdose. The patient will have increased respirations, lightheadedness, and agitation. To treat, we give pain meds, decrease anxiety, teach patient how to take slow, deep breaths, or breathe in a paper bag. Either way, you are solving the underlying cause. A trick to remember treatment: you are low in CO2. We can give you CO2 by breathing into a paper bag. Let's move to metabolic alkalosis. You are holding on to bicarb, causing high bicarb levels and high pH levels. This is caused by vomiting, suctioning, dehydration, circulatory shock, steroids, ingestion of antacids, and low potassium levels. Patient will be lightheaded, have nausea and vomiting, confusion, stupor, tremors, paresthesia, and or muscle twitching. Monitor vital signs, neurologic status, I's and O's, and stop taking the antacids. So let's do a down and dirty review. You are in respiratory acidosis when holding on to CO2. You are in metabolic acidosis when you lose bicarb via the kidneys. A trick to remember causes: you are in metabolic acidosis when you lose fluid through your acidosis area. You are in respiratory alkalosis when you lose CO2 via breathing too fast. You are in metabolic alkalosis when you lose bicarb via losing stomach acid, causing you to be basic. A study tip: you alk through your mouth. You are alkalotic by losing acid via your mouth. Or you can think of it this way: anytime that you puke, you make an alk sound, like alk, you puke it out. You are alkalotic, meaning you are losing stomach acid or CO2 through your mouth, causing your pH to increase or be basic. I hope this helped. Thank you so much for watching. Please like, share, and subscribe.